So welcome everybody. Thank you so much for coming along to the launch of our report, Housing as a Human Right. It is a gendered examination of the housing system and advocacy for systemic change. So I'll just do a tiny little bit of housekeeping. As you see, we're recording the launch and it will be posted to our YouTube channel and our website. So if you don't want to be recorded, just please turn your video off. We also have closed captions turned on, so please use those if you need them. And so today we'll be providing an overview of the report, and we'll be linking to the report at the end of today's session. But if you do have any questions as we present, then please put them in the chat and we'll take some time at the end. We will have time for questions at the end. So with that, I want to start our meeting by acknowledging the traditional custodians of the lands on which we meet across the state of Victoria and elsewhere. Wherever you are joining from today, we're all on unceded Aboriginal land, and I want to pay respects to elders past and present and extend those respects to any Aboriginal or Torres Strait Islander people here today. The development of the Australian housing system has played a significant role in the colonisation process and continues to entrench marginalisation and socio-economic inequity unjustly faced by First Nations people and communities. In addition to facilitating the dispossession of land and compromising care for country, the impacts of homelessness and housing insecurity disproportionately affect Aboriginal and Torres Strait Islander people. So in reimagining our housing system, we acknowledge the imperative for First Nations perspectives to inform and guide this work. So, why housing? Women's Health Goulburn North East are not a housing service and we don't pretend to be one. But we do work to address the systemic and social conditions that lead to poor health and wellbeing outcomes for women across our region. Access to affordable, appropriate, secure and climate-safe housing is a fundamental element to good physical and mental health. In recent years, communities across the northeast of Victoria and the Goulburn Valley have faced climate-based emergencies like bushfires and flooding, which have highlighted the need for a resilient housing system that provides a safety net for marginalised and disaster-prone communities in a changing climate. Of course, regional considerations are only part of the complex set of factors informing access to housing, health and wellbeing that we seek to address. Today marks the start of National Homelessness Week. Homelessness and housing insecurity are increasing across Victoria, spurred by the cost of living crisis and a housing system that is unable to provide a safety net for a growing number of people. We know that the majority of people experiencing housing insecurity are living in temporary, insecure or unsafe housing, and that women over 50 are the fastest growing cohort to face housing insecurity. Data from the Australian Institute of Health and Wellbeing tells us that 44% of people seeking assistance for homelessness in Victoria do so because of domestic and family violence. As a rural women's health service, the gendered drivers and impacts of housing insecurity are of particular concern to us. But of course, the health and wellbeing of women is also dependent on the health and wellbeing of their whole communities. So I'm now going to pass you over to Annika Stewart. Annika will take you through what our communities across our regions told us about housing and how this lived experience has shaped and informed a suite of recommendations advocating for systemic change. Thanks, Annika.
Awesome. Thanks, Amanda, and hi, everyone. So towards the end of last year, Women's Health Goulburn North East asked members of our community to tell us about their housing experiences, both the good and the bad, as well as inviting people to imagine how a better, more equitable housing system might look. Through listening to our community via surveys and in-person conversations in Wangaratta and Shepparton libraries, we collected evidence providing a regional and gendered perspective to the national housing crisis. So today I'm going to take you through some stories we heard, which centre around themes that we're particularly passionate about, like gender, climate change, regionality, and intersectionality. And next slide, thank you. We heard from one respondent, age 70, who said she was fortunate to have found a public housing home in which she had lived for 5 years. She said she took pride in her home. However, she lived in a state of hypervigilance, insecurity, and stress because her neighbours had noisy dogs, were disruptive, and because one neighbour repeatedly exposed himself on his front veranda. She said when she reported this behaviour to authorities and asked to be relocated to housing in a different area, she was told she'd have to put up with it because of a lack of housing stock. This woman expressed anger, frustration, and sadness at having raised 2 children, worked in aged care all her life, contributed to the community, paid her taxes, and was now being made to feel as though she was disposable because of her age, gender, and lower income status. We also heard from frontline family violence workers who see the lethal impact of the housing crisis, with women and children made to choose between staying in violent households with their perpetrators or leaving and risking homelessness because there's nowhere to flee to. And next one, Catherine. Thank you. Regionality only adds another layer of complexity to the housing experiences faced by those in our communities. In some towns across our region, house prices have increased significantly, benefiting some but pricing others out of their own communities. Inflated house prices are the result of discrepancies between housing supply and demand. In regional areas, this has been exacerbated during the pandemic by an influx of tree changes, as well as by the increase of short-term accommodation. We heard from respondents who had bought into regional housing markets after moving from metropolitan areas during the pandemic. For these people, regional areas offered an opportunity to achieve a degree of financial security that expensive city housing could not offer. According to news reports, tree changes relocated to regions such as Northeast Victoria during and after final lockdown because of factors like housing affordability, the ability to work remotely, and a desire for more space after being in lockdown for so long. Yackandandah and Bright are 2 such regional towns that have experienced pandemic-inspired regional migration and resultant price increases. According to realestate.com, median house prices in Yackandandah have increased by 65% over 5 years. Meanwhile, in Bright, prices increased by 122%. But several community members who responded to our survey and community conversations reported that these price increases meant they were no longer able to afford to buy a home in communities in which they had lived for years. For some, this meant they had to consider relocating to another town in order to find affordable housing that offered security of tenure. A woman from Indigo Shire said, "A lot of people from the city relocated to Yackandandah pre and during COVID. This pushed house prices up and availability down. Young people who've grown up in Yackandandah and want to stay in Yackandandah cannot afford to rent the few rentals that are here, let alone buy into the market. They either have to keep living at home or move away." And we'll go to the next slide, Catherine. Rural and regional areas are also significantly more likely to experience climate disasters compared to metropolitan areas. Communities within our region are still grappling with the fallout of the 2019 bushfires and the 2022 floods. The trauma of these disasters was compounded by the distress of trying to either access insurance payments for properties destroyed by water or flames, or of trying to find alternative housing in a tight regional rental market while homes were rebuilt. The double whammy of bushfire and the rental crisis was reported most directly by one community from Toowong Shire, whose home was destroyed by the 2019 bushfires. They said, "Since the bushfires, rent has nearly doubled in our area. It makes it totally unaffordable to live in a rural town where things used to be cheap and accessible." A woman respondent from Wangaratta said, A recent issue for us has been making sure our house is insured. Our provider recently decided they weren't going to insure us for floods anymore, as we, according to them, are in a high-risk zone. Finding someone to insure us has been a battle, and we've been quoted ridiculous amounts. A woman from Greater Shepparton said she'd been living in temporary accommodation following the 2022 floods, as the home she lives in is now inhabitable. She had 4 weeks of paid accommodation left by the insurance company, with no insight as to whether they would extend it. And next slide, please. When identity characteristics like gender, age, regionality, disability, and socioeconomic status come together and intersect, these housing experiences of marginalisation and discrimination further compound. We heard from community members who explained that unaffordable rental prices, coupled with inadequate pension or social support rates, have meant they've had to look for alternative housing options. A recent report by Anglicare Australia collated data to determine how many properties were affordable for people on government support payments. The report showed that across regional Victoria, no rentals advertised were deemed affordable and appropriate for a single person on job seeker or youth allowance, and only 2 properties were suitable for a single parent on job seeker. Only 1 property was affordable for someone on the disability support pension, while a single person receiving the age pension could only afford 13 or 0.5% of properties. A woman respondent from Benalla said, I have had to live in a motorhome for nearly 3 years as the private rental market rents are too high for a person on a pension. The cause of this is too many investors turn long-stay rental properties into short-stay accommodation for profitable reasons, and a lack of investment by government in social and affordable housing. While another respondent said, it took my mother 2 years of living on her friend's couch before her housing application was approved and she was able to rent her own home. She was a single mother who had 2 dependents with intellectual disabilities who required her to be a full-time carer, and so she had no additional income outside of Centrelink. So after speaking to our community members about their experiences of the regional housing system, we asked them to put forward their ideas for what better would look like. And we can go next slide. Thank you. We go through a range of these ideas in the report, but the major ones to come out were things like construct more public housing, phase out negative gearing and capital gains tax for investment properties, rent caps, expand renter rights and protections, including longer term leases. I'll go next slide, please. So Women's Health Goulburn North East listened to these ideas and overlaid our organisational values and expertise and developed 6 recommendations for advocacy and systemic change. Our recommendations can basically be summed up in what one community member said, which was, housing should be like chocolate biscuits. Make sure everyone has one before you go back for seconds. As true as that is, I know we still have a bit more time, so I will give you a brief overview of 2 of our 6 recommendations. So firstly, we need to challenge the narrative of the Great Australian Dream of home ownership. The Great Australian Dream is becoming increasingly unattainable for many people. To meaningfully address the housing crisis, we need to disentangle the meaning of home from home ownership. In Australia today, renting is no longer purely a temporary step before buying a house. However, as described by our community and broader research, it continues to be insecure and unhealthy with short-term leases in poor quality houses. We need to broaden the definition of home to ensure we are valuing different tenures equally, and for this value to be reflected in policy efforts and investment decisions. A home's security, stability, quality, and profitability should not be determined by whether you own it or rent it, privately or publicly. We need to reframe housing as a human right and a key social determinant of health, rather than a privilege reserved for the wealthy. We can do this by challenging the stigma around rental, social, and public housing in our national conversations, in the media, in our daily use of language and behaviour, as well as in policy, by ending preferential treatment of home ownership in Australian housing and tax policy, as well as undertaking prevention initiatives to address this stigma in social settings. Secondly, we recommend that the federal government formulate a national housing strategy that unifies the approach to housing nationwide, with clearly delineated responsibility and guidelines related to all levels of government and relevant bodies. Addressing housing challenges demands holistic and cohesive solutions, yet responsibility for housing and homelessness policy is fragmented across different levels of government, with capabilities dispersed across diverse agencies with narrowly defined roles. This fragmentation is contrary to the complex and interdependent nature of the housing system and acts as a barrier to adequately addressing housing and homelessness issues. The federal government needs to formulate a national housing strategy that unifies the approach to housing nationwide. We'll go next slide, please. Thank you. So some of you may know that independent federal parliamentarians Kylie Tink and David Pocock recently introduced a new bill before Parliament calling for housing to formally be considered a fundamental human right. The bill would require the government to create a 10-year national housing and homelessness plan, with the government of the day required to report on the plan's progress according to some overarching objectives. Women's Health Goulburn North East have made a submission in support of the bill, and we encourage individuals and organisations alike to put pressure on the government by making their own submission. And I will pop the link to that one in the chat. And with all that being said, I invite you to read the full report and check out the rest of our recommendations. Thanks, everyone. I'll hand back over to Amanda.
Thank you, Annika. And Annika will pop a link in the chat to the full report. So we'd really encourage people to have a read through that, and our contact details are on there if you would like to chat with us about it. I think the quote of the report for me is, we all get a chocolate biscuit and then wait until we've all got one until we come back for seconds. I think that's a pretty good principle to be working towards. So knowing that this has been an overview of the report, I guess what we hope is that you can have a look at. There are so many fantastic quotes and ideas from our community, and those have led us to those recommendations that we have, the 6 of them. Annika went through a couple of them there, but we hope that when you're thinking about your advocacy around housing, that you might think about these particular strategies that we're thinking about to make a systems change. So much of this has been so far dependent on the individual to work harder, to climb the ladder. And as Annika talked about, our great Australian dream is a bit of a nightmare these days, and so it just isn't there for everybody. So I think we hope that the report is of use to you in our region, that there are some things in there that you can draw out and use in your own advocacy work. And we'd also love to hear any feedback that you have about the report, because of course, as you saw, we put in a recommendation for a national housing policy, and look what's happening. You know, there's a there's a bill up, you know, already. So you can make change really fast in this area. So I would love anybody who has any questions to please ask them now, if there is anything, or any comments around the report. Okay, well, thank you, everybody. It's great that you've spent some time with us today, and I really appreciate it. I also just wanted to thank Catherine as well, who's been there busily in the background supporting us technically here. And so please do download the report and have a read, and please contact us if there is anything that you would like to discuss with us. So I might, instead of holding on, I will say thank you, everybody, and yeah, have a great afternoon, and really appreciate your attendance. Thank you.